What will happen if I am asked to take part in research? This video is about health and care research. It talks about what will happen if I am asked to take part in research. If you take part in research, you can make a difference to other people's lives. This is because health and care research is helping us to live better and longer with many illnesses. Illnesses like cancer, dementia, diabetes, long COVID, allergies and heart disease. Over 6,000 research studies happen in England each year. If you are asked to take part in research, it is completely your choice to take part or not. Taking part in research is a personal decision and it's always your decision. You are under no pressure to take part. And if you do join a study, you can stop taking part at any time. Your healthcare stays the same whether you take part or not. Taking part in research means you are joining a research study. The study will be asking a question. For example, how can we improve the support for older people with learning disabilities who are living on their own? Not enough work is done to support people with learning disabilities to understand and take part in research. Research should include people with learning disabilities. This video talks about what happens if you are asked to join a research study. Every research study has a research team. The research team can have a doctor, a nurse or midwife or other health and social care professional. The team will usually also have experts from universities. Research happens in hospitals, people's homes and in many other places where we live. Someone from the research team will ask you if you would like to join their study. The researcher knows that you are someone who could join their study if you want to. This is because every study describes who is wanted. For example, if the study is about support for older people with learning disabilities who live on their own, the research team will only ask you to join their study if you are an older person, you have a learning disability, and you live on your own. The researcher will give you a leaflet which has information about their study. They will carefully explain what the study is about and what you are being asked to do. They will ask you if you would like support to go through the leaflet with someone else. Sometimes, but not often, there is a video or easy read information about the study. The researcher will give you plenty of time to think about if you want to join. You can take the leaflet home and speak with your family or friends or people who support you. There is always an email or telephone number for you to contact the support team and ask questions. Research can also happen without you meeting anybody. This is when the research is online and you use your computer or smartphone to take part. You will have the same amount of information for online research. The information will be on the research website. What the study does is carefully explained in the information leaflet. There are different kinds of research studies. We talk about the different kinds of studies in another video. The other video is called What is Health and Social Care Research and Why Does It Matter?
All research studies are checked for any harm they might cause. The research team will carefully explain about any risks. The information leaflet will also talk about keeping you safe during the study. A group of people not connected with the study checks everything about the study before it can start. This group is called a Research Ethics Committee. This group has health and social care experts as well as ordinary people who have been patients or carers themselves. The study can only happen after the Research Ethics Committee has said so. Only the research team will have your personal information, such as your name and your health or medical condition. Sometimes the research team will ask you if it is okay to let your GP know that you are taking part in the research study. Once you have read about the study, the researcher will check that you understand what it is about and what will happen. If you are not sure, you can ask the researcher for more help. This help could be from an interpreter or a support worker or someone else with experience of taking part in research. If you are in a hospital, you might want to have a quiet space and more time to think. The researcher could use photographs, drawings, easy-read audio, visual or online information. They might treat a medical condition you have which is making it more difficult for you to think clearly, like an infection. You and the researcher must be certain that you understand what the study is about and what you will be asked to do. You'll then sign a form which says that you are happy to join the study. This is called a consent form. Once you have signed the consent form, your part in the study can start, and the research team will have you helping them to answer their research question.